here to give you the latest update on COVID-19 outbreak in Thailand. It will be everything about the COVID, what's going on, so you just watch our shows and you know everything that happened today, official information.
Yep.
So we're gonna start first news with the latest report of the youngest infected patient, which is a 7-month-old baby that related to the outbreak in Samut Sakhon. A 7-month-old girl in the province of Suphan Buri has become the youngest COVID-19 case since the start of the new outbreak, which originated in Samut Sakhon, that now spread in almost 20 provinces already, 16, 17 provinces. Suphan Buri provincial governor said that there are now 7 COVID-19 cases in the province. The baby girl's mother had been in Song Phi Nong district, where a 35-year-old woman was earlier found to be infected. In Samut Songkhram province, which is adjacent to Samut Sakhon, the provincial administration has ordered a lockdown of the province until January 4th after 6 people tested positive for coronavirus. 2 more cases are awaiting test results. All 6 confirmed cases are linked to Samut Sakhon, where more than 200,000 migrant workers from Myanmar are located. A 27-year-old woman also visited the mall Bang Kapi in Bangkok before she tested positive for the virus. Under the lockdown order issued by Samut Songkhram governor, all schools, including nurseries, cinemas, shopping malls, except for supermarkets, drugstores and food halls, are closed until January 4th. And in Nonthaburi province, just north of Bangkok, the provincial COVID-19 information center reported 3 new cases, including a Thai man, a Thai woman, and a Myanmar migrant worker, late Tuesday night. The northeastern province of Khon Kaen recorded its first case yesterday. A 24-year-old Thai woman who has worked at a seafood factory in Samut Sakhon since November 30th. She fell sick on December 17th and left for Bangkok the following day to stay with her sister at the dormitory in Ram Khamhaeng area before returning to Khon Kaen on a public bus on December 21st, arriving later the same day. So far there are 257 people in Khon Kaen who had traveled to Samut Sakhon have reported to health officials for swab test. So as of 10 a.m. this morning, Nakhon Si Thammarat confirms 1 COVID-19 infection, a 42-year-old food vendor that was working in Samut Sakhon, and now she traveled back to her hometown in Nakhon Si Thammarat in private car. She is asymptomatic, but she chose to get tested at a local hospital. Also, Nakhon Ratchasima confirmed 3 new infections, including 2 seafood vendors who brought seafood from Samut Sakhon and a 43-year-old man who visited his mother in Samut Sakhon. Also in Prachin Buri confirmed 2 new infections. Both of them are cargo drivers who transport shrimps to Thale Thai market in Samut Sakhon. And also Krabi province this morning confirms 1 new COVID-19 case, a 48-year-old woman from Myanmar who spent December 14th through 16th in Samut Sakhon while renewing her visa. She traveled in public service minibus with 7 other passengers.
And this is just in Samut Sakhon, which is the epicenter of this outbreak. It has recorded 121 new cases of COVID-19 today, bringing the total number of recent infections there to 1,184. Another piece of information that just came in, Phuket found 2 new cases of COVID-19 already. And at the same time, the Bangkok Metropolitan Administration has announced that they will have to close 437 schools in Bangkok from the 24th of December, which is tomorrow, until the 3rd of January. So this is the latest on COVID-19 situation in all the other provinces apart from Samut Sakhon. Meanwhile, the Prime Minister will chair a special CCSA meeting tomorrow on the measures to deal with the COVID-19 outbreak. Prime Minister General Prayut Chan-o-cha has called a special meeting of the Center of COVID-19 Situation Administration on Thursday to discuss measures needed to cope with the current COVID-19 outbreak, which has now spread to more than 24 provinces. The CCSA spokesman Dr. Thaweesin Wisnuyotin said today that the meeting will also discuss appropriate ways to look after millions of foreign migrant workers, including those who have been infected with the virus. Meanwhile, the CCSA today recorded 46 new COVID-19 cases in Thailand, including 39 locally acquired and 7 among arrivals from abroad in state quarantine. If we look at the numbers, which are the official numbers from the CCSA today, the 39 new locally transmitted cases include 11 in Bangkok, 5 in Chha Cheong Sao, 3 in Nakhon Pathom, 2 each in Kamphaeng Phet, Tak, Prajin Buri, Ayutthaya, Samut Prakan, and Saraburi, and 1 each in Phetchabun, Krabi, Khon Kaen, Nakhon Ratchasima, Nonthaburi, Pathum Thani, Phuket, and Suphan Buri. These are the numbers officially released by the CCSA today. The numbers you're seeing here is by this administration only, it has not included the recent infections that we just reported earlier. So the infection rates in the Mueang district of Samut Sakhon among those tested are 44% at the Central Shrimp Market, 14% at the Thale Thai Market, and 1% at fish markets. The average infection rate is 22% and it's decreasing. Dr. Thaweesin said the Public Health Ministry has set a target to test 10,000 people, but he conceded that the most worrisome is not the Myanmar migrant workers, but several thousand Thai vendors who visited Samut Sakhon to buy seafood. He also appealed to provincial governors to provide updated information about infections in their provinces to the CCSA first, before releasing information to the media to avoid confusion over the actual number of infections.
So talking about migrant workers from Myanmar, CCSA actually asking the public to be more sympathetic and more understanding of the Myanmar migrant workers, especially the one that being infected with COVID-19, because they have been a center of the news. Yes. That they are the illegal one is the cause of the outbreak, as said by a lot of people, a lot of officials. So CCSA spokesperson Dr. Thaweesin Wisnuyotin said during a news briefing today that the migrants are in the same boat as the rest of the country as far as the COVID-19 is concerned. He said that the migrant workers have made great contributions to the Thai society by working in sectors that most Thai people shun, and they should be treated as part of Thai society, especially in times of difficulty. Dr. Thaweesin cautioned against stigmatization of the migrant workers who are being seen as a source of the new spread of the virus. Samut Sakhon, the hotspot of the latest surge in COVID-19 infections, has one of the largest communities of Myanmar migrant workers who mostly work in the seafood industry. So far, more than 1,000 people in the province, mostly migrant workers, have tested positive for the virus. So Dr. Thaweesin said that he appealed for understanding and sympathy for these workers. He also suggested that to show their goodwill and empathy, Thai people may want to consider mobilizing efforts to help the affected migrant workers with necessary supplies and daily basic items. He recalled that such an act of kindness was most visible during the month of lockdown of the country earlier this year, when people joined support groups to offer help to those affected by the impact of the pandemic. The Central Seafood Market and living quarters of migrant workers in Samut Sakhon have been put under virtual lockdown since Saturday, after hundreds of their residents tested positive for the virus. It is estimated there are as many as 300 to 400,000 migrant workers in the province, many of whom believed to have entered the country illegally. Prime Minister Prayut Chan-o-cha on Tuesday, he said that he will crack down on smuggling rackets that brought in the illegal immigrants.
So based on the current situation here, people have sort of focused on the migrant workers, but in a way, the CCSA just said that we should sympathize a lot more because they actually contribute to the Thai economy. But another question that we might be asking is that how do Myanmar people perceive the current situation of the outbreak in Samut Sakhon? And right now we have the associate editor of the Irrawaddy News, Ms. Yen Yen, who is joining us right now. Sorry, did I pronounce your name correctly?
Yes, you did. Hi.
Hi,
Yes,
good afternoon.
Good
Thanks
afternoon.
for agreeing to come on the show with us.
thank you. Thank you for inviting.
So first of all, I have to ask the question whether this latest outbreak in Thailand amongst Myanmar's workers is a news interest in the people in Myanmar, in the society?
Yes, indeed. Is as far as I can tell, the Myanmar peoples across the countries are closely monitoring the news. Yes.
So how most people see or feel about this news, do you know?
Generally, the migrant workers are, they have so many family inside Myanmar. Mm-hmm. So, people worry for their family members because the latest outbreak center is where many migrants work. And also, people got confused following the news that, why all of the sudden, they are, being pointed fingers at the sources of outbreak,
right?
To the migrant community alone. So at the same time, because people are worried to those, migrants, the consequence or what would happen to them,
right.
Will there be any discrimination, any hate, speech against them, or any, that the consequences is, that what people are worried a lot.
So what is your own thought about this news, the information you have been hearing on, I guess, from the Thai media, probably more than the Myanmar media itself?
Yeah, we follow the Thai news very closely. But for both in Thai and in English, but more in English news. So based on the news that we heard about the Prime Minister comment about migrant workers and illegal migrants spreading, implying that illegal migrant workers spreading or Myanmar migrant workers spreading this disease, right. It doesn't look good, and it's I think many of us feel like discrimination against. Why we should be dealing with the public health issues regardless right. of the situation, because as the other the migrant organization and other key officials or Thai officials talking that there should be no prejudice or no discrimination right. against the Burmese migrant workers. And so I totally share the same views as some Thai people who are genuinely helping out the migrant communities and trying to reduce the negative narrative against the migrants. So I would like to say thank you to all these Thai people who are helping and who are having positive positive view towards migrant workers. I think as these workers, they've been as you said, they've been contributing a lot to the Thai economy.
Yes.
And also their remittance to the countries is also contributing a lot to the Myanmar domestic economies, right? So in this Christmas period and holiday period, they be already trying to remit their money during their only one day of holiday on Sunday.
Right.
And then like we heard from our friends in Bangkok and Samosakon, they've been like treated, how do you say, bad, and they've been like discriminated, and at the bank, and because you are Burmese migrant and we don't want to get near you. But these migrants who are using this financial service, they are actually legal one. They are living in the Thailand for months since the COVID lockdown. So these kind of like, how do you say, these kind of narratives that could look bad on the migrant community, it should not happen.
Right.
So how do Myanmar people perceive the media coverage about the outbreak in Thailand? Do they feel that it has stigmatized the migrants even more?
Well, when I talk to the people in the Talat, near the Talakung and Mahathai and other areas, because they listen to the Thai news and they feel, discriminated against. They feel, marginalized because some like local news has been pointing them as like a sources of the virus or the these negative view. But they like say, no, we are not. We are staying here, and then this should not be that way. But also we are also really thankful to other some Thai media and English language media for paying attention to this issue and sharing information that we should know. So yeah, there are mixed feeling and about the new coverage, but we really thanks the coverage that you and others like media are having to cover and to improve the welfare, to improve everything, the updating the situation about the COVID situation, especially in the migrant communities.
And apart from the media coverage, recently the spokesman of the committee dealing with COVID-19 in Thailand have also asked the Thai people's sympathy and understanding of the Myanmar workers here who have been affected by the pandemic. In your perspective, would this help reduce the stigma against migrant workers?
Well, we are hoping, but what has been said is not easy to erase, because on Saturday, and the health minister has already told blame the migrants for the like a virus or super spreader, and then yesterday the prime minister also said again. So that they are powerful, right? So we think like, how do you say, correction of these. The correction always goes slow.
Right.
All the time, all these disinformation or like information without concrete evidence go faster than the actual true news, right?
Yeah.
So but we are still hoping that Thai communities and Thai people will change their narrative and will get their put more understanding on the Burmese migrant and see them as a part of the communities, and that we have to fight together to the virus, because it is a global pandemic, and all the world are having these problems, not alone, not only Myanmar or not only Thai people, right?
Have you have a chance to talk to anyone in Thailand, migrant workers in Thailand, Myanmar worker in Thailand?
Yes, I do talk. Since the news outbreak, I do talk to number of people,
right?
And that message, because it is high, from the high political figure, is not only affecting the migrants in Bangkok or Samosakon communities. It's also affecting to the down south like Phang and other provinces in the whole countries.
Right.
They've been telling me that they also face such discriminations,
right.
Feeling discrimination, and not the one migrant told me this morning that yesterday I came back from work, and because he was in Mahathai, the hotspot of the area, so he said sometimes the people in the community trying to avoid them because
Right.
they saw the Burmese workers.
Right.
So that they feel stigmatized, they feel marginalized,
Mm-hmm.
and why do they do that? They ask questions and they share these kind of stories to me.
Okay.
And can you explain a bit further about the living conditions that they have to face for the migrant workers here? Because some people still don't really understand how they actually live their lives, especially in the fishing province of Suphan.
Did they tell you anything about that?
Yeah, I've been to the Samosakon and Mahathai area this August. So when I was reporting about early voting for the Myanmar general elections, so I saw their living conditions, and they live in the not only in Mahathai, everywhere that I've been there, in down south or in Thai, in Bangkok, they live in the pack, communities. Many many family members or a group of people stay in the small room together. So there is no very difficult for the social distancing. For COVID prevention, you have to be 6 feet apart.
Right.
But what if you are staying for 3 or 4 people in the one room? How could you do that? So that is the alarming. What if one of the migrants have a COVID, and they could spread their roommates could be, or their family member could be a primary contact to, and the primary risk. Also, I would like to add one of the migrant that I talked today from the Central Street markets in Mahathai. They said they cannot go out because of the lockdown.
Right.
And also they are although they are thankful to the Thai communities for helping and other foundation for supporting food and everything, they are worried for their health concern because they said they have been tested over the weekend.
Right.
And then nobody replied then about whether they are negative or positive, and they don't know the result.
Okay.
So that's confused them.
Right.
Where do we go? Whether we are negative or should we avoid, our family members,
Right.
things like that. That should be information should be more transparent.
Right.
But I know that from the news coverage, that Thai authorities and Thai officials are really good at doing, faster information and transparent. But with the huge number of migrants,
Right.
I think their concern also is a legitimate concern.
Mm-hmm. Okay.
So, with the recent announcement by the Thai Prime Minister where he threatened to take action against human trafficking networks smuggling migrants into Thailand, on this issue, what about Myanmar authorities? How concerned are they about this issue, and how do they hope to cooperate with Thailand on this?
I don't know exactly the development of the current, agreement or the cooperation that the bilateral, authority might have been. But generally, as a people of Myanmar, people from Myanmar, I can say that we are very concerned about
Right.
all those smuggling network or trafficking network, and because it is true that there are many illegal migrants in Thailand. And there has to be 2 or 3 ways to look at whether either they come illegally during this year, during the COVID lockdown, because as you know, the border has been sealed and the border has been officially closed, and only Myanmar government accepts the migrant returnees, and there is no one allowed in.
Right.
So maybe they should look at the policy, how to how to recruit the migrant workers, because Thailand economy need these workers.
Yes.
Because especially when I was in Mahathai, people say, they need a lot of people because people go back, and they need a lot of people for the seafood industry to work. And so there is so many, people, there is a network, people trying to recruit more people, and they are waiting to get
Right.
into Thailand. There is no official way to go there.
Right.
Maybe the government should, consider having more official channel open
Right.
for the migrants, recruited migrants only.
Right. Well, thank you very much for your time, Yin Yin.
Thank you
and
so
thank you
much.
very much for the information. And please stay safe.
You too. Thank you.
Thank
Thank
you.
you.
Bye.
Bye.
And that is the associate editor of the Irrawaddy News in Myanmar. She has been in Thailand quite frequent,
Yep.
and she has been meeting with the Myanmar community, especially in Samut Sakhon. She said almost every year,
Yep.
except for this year, of course, because of the COVID-19. Like she said, that there is some concern of the living condition, and she has been talking to the migrant in Mahachai themselves. There's some confusion about the information going on, who tested positive, who tested negative. But from our side, we get information from our CCSA that what is the number of positive cases each day. But maybe it works differently in there because like Yin Yin said, there's a lot of people in that confined area.
At least she gave us a bigger, more of a perspective of
Yes.
what is really happening, especially with the living conditions. So a more comprehensive perspective of what is actually going on there.
So the Prime Minister today has asked the public to notify officials of illegal migrant smuggling networks. He issued a statement that posted on the Foreign Affairs Ministry website, and he asked the public to provide the authorities with any information they may have on illegal migrant smuggling networks, which he believes are the cause of the latest COVID-19 outbreak in Samut Sakhon. He also asked people to be more careful and not to share misleading messages that could create panic and project a false image of Thailand abroad. Prayut said that illegal migrant workers in Thailand are not a cause of the problem, but those who have snuck in illegally are because they didn't go through COVID-19 screening process. Related agencies have been ordered to investigate the migrant smuggling networks and find factories which hire illegal workers. And talking about the factory that hire illegal workers, last night there was a news that some employers reportedly abandoned illegal workers on the street, fearing punishment from hiring them. So Prayut also asked the Interior Ministry, Labour Ministry, and related agencies to find appropriate solutions to register migrant workers. In a statement, he asked the public for cooperation and to report to the office of the Prime Minister directly any information related to the smuggling networks and corruption. He also asked the media to report news that has been issued by the Center of COVID-19 Situation Administration or CCSA and not to mislead the public or public false information. And at the end of the statement, Prayut said that the government knows the cause of the latest outbreak and has already rolled out several measures to contain it. He assured the public that the current health measures in Thailand are efficient and asked the public to believe that Thailand is doing better than many other countries.
On to business and economics. The new COVID-19 outbreak is expected to cost at least 45 billion baht in economic damage if the virus is not contained in a month. It has been estimated that the current COVID-19 outbreak will cost the Thai economy about 2 billion baht a day or as much as 60 billion baht a month if the contagion is not contained, according to the forecast by the Economic and Business Forecast Center of the University of Thai Chamber of Commerce. Assistant Professor Thanawat Ponvichai, Advisory Chairman of the Center and Rector of the Thai Chamber of Commerce University, said today that economic losses in Samut Sakhon province alone are estimated at about 10 billion baht a month,
Right.
based on the estimated billion baht per day revolving funds in circulation, 70% of which is related to the seafood industry. He noted that for the time being, most of the factories in the province, export and domestic trading of seafood have not been seriously affected and no cancellations of export orders have yet been reported. With the proactive tracing and testing efforts now underway, he believes that the COVID-19 outbreak will be under control within 14 days
Right.
if the rate of infections outside Samut Sakhon is kept to fewer than 10 cases a day. Meanwhile, the Kasikor Research Center estimates the economic loss within a month at about 45 billion baht, but that could be much less if the situation is brought under control quickly, noting that no cluster infections have yet been reported outside Samut Sakhon and limited lockdown measures are still in place in some provinces. The center anticipates economic losses in 3 areas, namely the seafood sector and related industries, estimated at about 13 billion baht, cancellation of New Year festive activities, estimated at about 15 billion baht, and a reduction in travel, estimated at about 17 billion baht. The center also said that there are other businesses being impacted by the virus outbreak, the economic damage to which cannot yet be assessed. So this is the perspective from 2 places, which is the Thai Chamber of Commerce and Kasikor Research Center on the economic damage if the virus is not contained.
Of course, they're going to have some effect, and the economy will recover even slower than we expected before, because we have to limit the social activities, and of course it will affect the economic activities as well. Like in many provinces have already canceled the New Year activities, including Bangkok office, the administration office also canceled the New Year countdown activities and also order the closure of all schools under BMA office.
Yes. And that wraps up tonight's edition of Thai PBS World Tonight. Thank you very much for watching, and we'll see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ